Hello. How are you? Today we will discuss about heart disease. It's an introduction lecture further. We will discuss in more detail without wasting time. Let's start. Welcome to my channel. Professional unit. The heart is a truly remarkable organ, beating more than 40 million times per year and pumping over 7,500 liters of blood a day. In a typical lifespan, its cumulative output would fill 3 supertankers. The cardiovascular system is the first organ system to become functional in utero at approximately 8 weeks of gestation. Without a beating heart and vascular supply, development cannot proceed, and the embryo dies. When the heart fails during postnatal life, the results are equally catastrophic. Indeed, cardiovascular disease is the leading cause of mortality worldwide. Although a wide range of diseases can affect the cardiovascular system, the pathophysiologic pathways that result in a broken heart distill down to 6 principal mechanisms. Failure of the pump, obstruction to flow, regurgitant flow, shunted flow, disorders of cardiac conduction, rupture of the heart or major vessel, failure of the pump. In the most common situation, the cardiac muscle contracts weakly and the chambers cannot empty properly, so-called systolic dysfunction. In some cases, the muscle cannot relax sufficiently to permit ventricular filling, resulting in diastolic dysfunction. Obstruction to flow, lesions that prevent valve opening, for example, calcific aortic valve stenosis, or cause increased ventricular chamber pressures, for example, systemic hypertension or aortic coarctation, can overwork the myocardium, which has to pump against the obstruction. Regurgitant flow, valve pathology that allows backward flow of blood results in increased volume workload and may overwhelm the pumping capacity of the affected chambers. Shunted flow, defects, congenital or acquired, that divert blood inappropriately from one chamber to another, or from one vessel to another, lead to pressure and volume overloads. Disorders of cardiac conduction, uncoordinated cardiac impulses or blocked conduction pathways can cause arrhythmias that slow contractions or prevent effective pumping altogether. Rupture of the heart or major vessel, loss of circulatory continuity, for example, a gunshot wound through the thoracic aorta, may lead to massive blood loss, hypotensive shock, and death. Thanks for watching. Have a nice day.